Hello, welcome to video 1 of my new health education video series. My name is Jimmy Oakley. I will be your series narrator. I'm going to warn you up front, I'm not a professional voiceover artist, so I tend to make a few mistakes when I do one of these things, so please forgive me when I do. The video title today is What is Addiction Education? You have questions, I have answers all about anyway. Addiction as an issue affects people from all walks of life. Not only is the addict affected, those people close to the addict will feel the destruction of addictive behavior. Addiction is a chronic, often relapsing brain disease that causes compulsive drug seeking and use despite harmful consequences to the individual that is addicted and to those around them. Now, that being said, there are factions that would have you believe that an addiction is not a disease, but instead a bad habit that can be completely cured. This publication will not take a stance one way or the other. On one side of the argument are those medical professionals that claim addictions are chronic and often relapsing brain diseases that causes a compulsive desire to seek out the drug of choice in order to satisfy this compulsive behavior. On the other side of the argument, you have other medical professionals that claim that addictions are a dependency on a substance caused by an underlying medical issue, and that once the medical issue is resolved, then so will the addiction be cured. I can see both sides of the issue pretty clearly. However, it is not my position at this time to lean to one side or the other. That's a discussion for another time and place. I will endeavor to remain neutral in that ongoing debate. I am merely presenting facts concerning all facets of addiction. I do have my own opinion, but this is not the place for me to voice that. Drug addiction is claimed a brain disease because the abuse of drugs always leads to changes in the structure and the function of the brain. Although it is true that for most people the initial decision to take drugs is voluntary, over time the changes in the brain caused by repeated drug abuse can affect a person's self-control and their ability to make sound decisions, and at the same time send intense impulses to the brain demanding that you take your drug of choice. It is because of these changes in the brain that it is so challenging for an addict to stop using. Similar to other chronic relapsing diseases such as diabetes, asthma, or heart disease, drug addiction can be managed successfully. Fortunately, there are treatments that help people to counteract addiction's powerful disruptive effects and regain control. Research shows that combining addiction treatment medications, if available, with behavioral therapy is the best way to ensure success for most patients. Some of the tips you'll learn in this book include how to spot the signals that someone around you is addicted, how to spot the symptoms of addiction to different drugs, and just how devastating children on drugs really is, and how to know your teen is using drugs. You'll also learn how to teach your children to say no without feeling guilty. You'll find out where to go when you need help for pretty much anything relative to addiction. You'll learn the 12 myths of addiction. And you'll also learn what an intervention is and should you organize one to save your loved one. You'll also find the importance of setting personal goals, a step-by-step educational program to help you develop a successful recovery plan. You'll learn my own recipe for a complete remission and the path I recommend to long-term permanent recovery at the end of my book. Thanks for watching video 1 of my health education video series. For additional information on addiction education, you have questions, I have answers, please visit www.addictioneducation.net. I'll see you in Health Education Video Series number 2, Addictions Start Because of an Inability to Accept Suffering as an Intimate Part of Life. I'm Jimmy Oakley saying, thanks till next time.